Assalamu alaikum. So today's lecture is about continuous passive motion CPM. What is CPM and what is continuous passive motion? We will discuss in today's lecture. The definition, the general guidelines and the benefits of this passive motion. Starting from the definition of CPM, CPM is continuous passive motion refers to passive motion performed by any mechanical device that moves the joint slowly and continuously through a controlled range of motion as it is shown in the picture that is in this slide. After that, we will check what are the general guidelines to perform this continuous passive motion. First of all, the device may be applied to the involved extremity immediately after surgery while the patient is still under anesthesia or as soon as possible if the bulky dressings prevent early motion. This one is the first general guideline that the device may be applied to the extremity and then the continuous passive motion can be performed as soon as possible. Moving towards the second guideline, after providing the machine to the extremity of the patient that needs that passive motion, the arc of the motion of the joint is determined. Often in the initial stages, 20 to 30% is initially used and then progressed per day 10 to 15 degrees as tolerated. So the patient a portion of the range used initially is based on the range available and how much the patient can tolerate. This is the second general guideline for CPM. The third one is the rate of motion is determined usually one cycle per 45 seconds or 2 minutes is well tolerated for the patient. This is this guideline is showing the time and the rate of motion that the continuous passive motion can be performed. After that, the fourth general guideline for CPM is the amount of time on the CPM machine varies for different protocols. Like in some, there is continuous passive motion for 24 hours, or in some cases, there's continuous motion for 1 hour, and it is repeated 3 times a day. Longer periods of time per day reportedly result in shorter hospital stay. Like if the periods of the time are divided, so it will result in better recovery. The recent study compared short duration (CPM 3 to 5 hours per day) with long duration (CPM 10 to 12 hours) and found that the patient compliance and the most gained range occurred with a CPM duration of 4 to 8 hours, that is close to 3 to 5 hours per day. After this fourth general guideline for CPM, the fifth one comes, that is physical therapy treatments are usually initiated during this period when the patient is on not on CPM, including the active assistance and the muscle setting exercises that are very important for the patient after surgery. It is important that the patients learn to use and to develop the motor control of the range of motion as the motion improves. So, the after CPM, the physiotherapist must perform the range of motion techniques that are better to develop the motor control for the patient. After this fifth one, the sixth general guideline comes, that is the duration of at the duration minimum for CPM is usually less than 1 week or when a satisfactory range of motion is reached. So it is not for like 1 month, or it's just for short time, because CPM devices are portable and home use is possible in cases in which the therapist or the physician deems additional time would be beneficial, like if it demands 2 weeks or 2.5 weeks. So the CPM devices are portable and that can be provided to the attendants so that they can this kind of continuous passive motion can be performed at home. That is beneficial. In these cases, the patient or a family member or a caregiver is instructed in proper application how to uh, operate that modality. After that, the seventh CPM guideline comes, that CPM machines are designed to be adjustable and easily controlled, versatile and portable. Some are battery operated and they allow to the individual to wear the devices for up to 8 hours while functioning with the daily activities. These were all the general guidelines for continuous passive motion. After that, we will check what are the benefits of continuous passive motion. Continuous passive motion prevents the development of adhesions and the contractures, so it avoids the joint stiffness. It provides a stimulating effect on the healing of tendons and ligaments because it is providing continuous motion, enhances healing of incisions over the moving joint also. CPM increases synovial fluid lubrication of the joint, thus increases the rate of intra-articular cartilage healing and the regeneration of the tendon and the joints. It prevents the degrading effects of immobilization because it's a mobilization technique, obviously, and it provides a quicker return of range of motion because in this time period when the range of motion techniques are also performing, so it provides a quicker return of range of motion. It decreases post-operative pain also after surgery. It decreases pain. These were all the benefits of continuous passive motion because it increases the blood flow. So in this way, it decreases the pain. After that, there's some important tips, or we can say a very important topic about functional patterns. So how to perform the range of motion or through functional patterns. This slide is basically about that topic. To accomplish motion through functional patterns, first determine what pattern of movement is desired and then move the extremity through the pattern using the manual assistance or mechanical assistance if it is appropriate, or then self assistance from the patient. Second one is that functional patterning can be beneficial in initiating the teaching of ADL, that is activity of daily life, and instrumental activities of daily life, uh, IDL, IADL, as well as in instructing the patients with visual impairments in functional activities. Utilizing the functional patterns helps the patient recognize the purpose and the value of range of motion techniques and develop the motor patterns that can be used in daily activities as to strengthen and to improve the endurance. So this was all about the range of motion through functional patterns and what was CPM and the benefits and general guidelines. This topic was from the chapter number 3 of range of motion from the therapeutic exercises foundation and techniques book 7th edition. The pictures thumbnail can be provided in the picture of the book can be provided in the video's thumbnail. So more lectures from this chapter. Uh, you have to subscribe this channel, Physiotherapy Lectures. Thanks for watching.